Hello, my name is Anthony Owa. I'm a UK and US trained ear, nose and throat surgeon. My background is that I spent most of my childhood and adult years in Nigeria, principally Lagos. I went to medical school in the University of Benin in Nigeria and did national service in Zaria, up in the north. I've been in different parts of the country. I love Nigeria. I love my homeland. However, I'm a bit concerned about COVID-19 infection, and some of you may actually recognize my voice, my face from various COVID-19 videos I've produced. Some of them advise you on prevention, some treatment, and what to do if you do develop a COVID-19 infection, and also in relation to the myths that people have developed around this infection. Certainly regarding onions, turmeric, and garlic, which I must say people have felt that it's effective against the virus. It is not. You may argue that it may help your immunity, which I have no argument against, but you have to bear in mind that these foods are eaten commonly in countries like China, India, France, Spain, Italy, and despite the high intake of these foods, they still got very nasty infection that affected the whole of the country. So be wary about those foods. Now I hear people are concerned that it's a political scam. The mere fact that you see me in this protective equipment to see patients should tell you that it isn't a joke. Because a lot of my colleagues have died seeing patients either knowingly or unknowingly who have had COVID-19 infection and pass it on to them, because it's not always obvious that the patient has an infection. It is no scam and is a very serious infection. I won't argue with the fact that some people make money out of it illegally. And whilst I won't delve into that, people also make money out of it legally. You can go from the drugs like paracetamol, even hydrochloroquine, which people have not really found to be effective or any better than your natural immunity. Protective equipment, people have made money from making them, both here in the West and also in Nigeria. People make money from funerals, for example. People always make money out of a sad situation. That's the way of the human beings. But you have to take this virus very serious, because when it affects you, not the person that's trying to make money out of it. Some people say it only affects the rich. I've heard that on various social media. It's not true. It may have come from abroad, and this is the reason why the initial people that you felt had the infection were the rich. It started from China. The first index case was an Italian, and from there it spread from various international terminals, the airports. But then again, it started affecting everyone, because the virus doesn't care who it affects. It's only looking for food and shelter, because it can only exist within the body, and it lies in wait outside of the body until it can find a suitable host, where it now causes problems by replicating its own self to the detriment of the human body or the host. So it's not just the rich. The poor can get it, the middle class can get it, your driver can get it and give it to you if you're rich. And conversely, the rich man coughing around is not the person to be around in, even if he's your political master. Because I see people in political gatherings coming close. I've seen people gather around the hearse, and immediately afterwards they have problems. And you can see even in the States, in gatherings, everyone gets it. So be wary about disbelieving the COVID-19. It is not a nice infection to get if you do get it. It spreads by aerosols. In other words, you cough or you talk, you breathe deeply, or you're in an enclosed area, the virus comes out and stays in the air for a few minutes before it drops down. Some cases may last longer or may be recycled in the air, which is why it's not nice to be in an enclosed place, and which is why it's always helpful to wear a mask. A mask will prevent it from coming out, and if you wear a mask such as this, it will actually prevent it from coming into you. The mask helps. It doesn't desaturate. I wear the mask routinely for long operations without it affecting my ability to operate properly. It doesn't make me drowsy. It doesn't affect my ability, so it works. It doesn't starve you of oxygen. And there are various studies to prove that. This, combined with good hygiene, And if you remember some of my videos, I come up with a scenario where I said a good slogan would be plead, where your personal hygiene is important, wash your hands, keep yourself distant from other people, keep surfaces clean, use antiseptic to clean surfaces. That would help prevent the spread of COVID-19 infection. So a mask is not a toy. A face shield does not prevent it unless you're wearing a mask. And this virus can go through your mouth, your nose, and your eyes. So perhaps we're in less optimal wearing glasses, but then it can go around your glasses to get infected, which is the reason why I'm wearing this as well. There's an issue regarding 5G. 5G are radio waves, as you have with remote controls for televisions and some cars, and also useful for data transfer. It's certainly much more powerful in terms of messaging than the 4G, and it's because it's a higher frequency and it doesn't travel too far. There's no evidence that it hurts anybody. It's different from the ionizing radiation that you have with CT scans, or you have with radiation, or even electromagnetic waves that you have from the sun, which can also be harmful. It is also not the same as a virus. A virus, it doesn't take up any significance until it enters the body. It becomes a living being within the body, converts the function of the body into its own use, and destroys the cells at the same time. It's a parasite, and it's completely different from the radio waves that you have with 5G. That also distinguishes it from the malaria parasite. The virus will affect all cells it comes into contact with. In terms of COVID-19, it principally affects the lungs and the airway, and causes a lot of problems with that before it causes generalized problems with clotting, and also cause the body to react to it and cause a lot more problems that way. However, the malaria parasite affects many red blood cells. It breaks it up and goes occupy other red cells and interferes with the body in that way. It's a parasite which can subside, it can exist on its own, rather than the virus which only takes up living form when it's inside the body. Which also is the reason why it doesn't give you the same immunity. They don't have an interactive protection with each other. That leads on to the use of the chloroquines or hydroxychloroquine, which some people believe that it helps. Now, the studies that have been done have conclusively shown that it's no use in established COVID infection. If anything, it causes more problems. With the heart especially, it can cause blindness, it can cause kidney problems, amongst other complications. There has been some sign that it might be helpful in prevention, but this is not proven. Some people are doing studies to see if it helps with very early disease. This has not also been established. So I would strongly advise that you be careful, because there's no evidence that it's better than your own natural immunity. So you're far better off making sure you're well hydrated, you eat well to build up your immunity, and that usually helps, especially with additional activity to clear your lungs and to keep yourself active. The only drug that is of use are steroids, and that is not helpful in early disease where it can even cause more problems. But in terms of people that are seriously ill with COVID-19 infection, it can be of use. And I hope in these few minutes I've been able to educate you in terms of the myths that can cause you more problems if you believe them and apply them to this pandemic. God bless you, and I hope you good health. Bye for now.